Budget and Finance Committee meeting. If there's no objection, we'd like to move RS 2018-1032 to the end of our agenda. Thank you. No objections. With that said, we're going to delve into resolutions. RS 2018-1022, sponsor Virture, appropriates $15,303,700 from the general fund reserve for the purchase of equipment and building repairs for various departments of Metro government. Is there a motion? It's been moved and properly seconded. Councilman Glover.
Thank you, Madam Chair. How do you want to do this? You want to take it by department, or how do you prefer to look at this resolution?
We can take it by department.
Okay. Then I've really got one big question for the fire department, please.
Is it Captain Swan or Commander Swan? I always get it.
It's Director Chief Swan.
Director Chief Swan, okay.
She's demoted me quick here.
Director Chief Swan.
Wrong branch, huh?
Yeah, that's it.
So, Madam Chair, what I want to make sure of is I had talked to Mr. Jameson and our legal staff. I want to make sure the ladder truck is covered in the 4% fund, which it looks like it is. The real question I have to ask is, why are we not putting that against our self-insurance fund? Why are we doing it this particular way? Anybody want to answer? Or shall we just sit here and stare at one another?
We'll let the Director of Finance.
That is a recommendation from Finance that because that's typically how vehicles are paid for, and fleet costs are expensed through the 4% fund, and it would be another hit to the self-insured liability fund, and we have other expenses that hit there. So we just felt like that this was the best source.
Okay, well, but I want to ask a question. Was it an accident? It's my understanding it slid backwards. And I mean, correct me if I'm wrong. I mean, help me understand why we're doing it exactly this way.
The chief would have to speak to the actual incident,
okay,
and what happened in terms of the damage to the truck.
Okay. Chief?
Yes, well, during the ice storm, we was responding to Rural Hill on the MVA, and the ladder truck was actually parked at the top of the hill, and basically it just started sliding, basically sideways. It hit a guardrail and it flipped upside down. Thankfully, no one did get hurt or injured, but it did total the fire apparatus or the fire truck.
Okay, so then I go back to, and I'm not saying it's right or if it's wrong, but I'm trying to understand if in fact it was an accident, and thank goodness nobody did get hurt. I'm grateful for that. But if it was in fact an accident, why are we not utilizing our self-insurance fund? And now we're pulling it out of the 4% fund. It's as though we're buying a new truck as though one didn't already exist.
The Director of Law has told me that historically, when we have tapped the self-insurance liability fund, it has been for damage to other people's vehicles and not vehicles that belong to Metro. And since we have the 4% fund that is specifically for Metro equipment, that this would be the best use of, the best source of funds to replace the ladder truck.
Okay, so then, Mr. Cooper, since you're speaking through her, I'm going to ask you a question.
Yes, sir.
So, have we ever had this occur before where we, I mean, this is kind of a weird accident. A very heavy truck, top of a hill, slid backwards, flipped over, et cetera. And so, I thank goodness, once again, nobody got hurt. But I'm still trying to figure out why insurance doesn't kick in. Is it better for the city to do it this way than it is to take it out of our self-insurance
Well, if you.
Don't cost $1 million either way, right?
Money's fungible, so it's all coming out of the general fund, the GSD general fund. But with the 4% funds, you have funds that are specifically set aside for equipment purchases. The self-insured liability fund is to address claims against the government where one of our employees runs into somebody, or, I mean, there's a couple settlements on for tonight.
Right.
So I think it's just it's from one bucket or the other. It makes the most sense out of the 4% fund since it is for replacement of equipment.
Okay, so then I'll close with this particular statement. If we have other issues that need to be fixed inside of the fire department, are we utilizing those same funds in order to make sure it's paid for, or are we now saying we've run out of money? And I'm talking about specifics on repairs, et cetera, et cetera.
In this 4% allocation, there's a recommendation for additional 4% money for the fire department.
Okay, in order to cover other things they need.
To meet other needs in the department.
Okay, thank you, Chair.
Yes, there's $500,000 listed for other needs.
All right, thank you, Chair.
Thank you, Councilman. Vice Chair Schulman.
Thank you, Madam Chair. Couple of questions. This is for a request for the Emergency Communications Center. It's on that ShotSpotter alert system.
See, we have Mr. Matthews coming up.
Thank you, Mr. Matthews. So I've heard of this before. I've actually seen it. And the question is, where is it going to go?
So we're looking at 3 square miles in the city as a one-year pilot. There will be 1 square mile around the James Casey public housing. There will be 1 square mile around the Napier-Sudicum public housing, and there will be 1 square mile located in North Nashville that will be inclusive of both the Cumberland View and Cheatham Place public housing, but the central point will be around Elizabeth Park and the Buchanan Avenue area.
All right, and just for the purposes of councilmen who may not know, can you explain how this actually works?
So it's gunfire detection technology. They place sensors on both telepoles or buildings. They do it strategically within the square mile area that it will be covering, and it will triangulate gunfire to the exact longitude or latitude of where it happens. It can actually determine the caliber of the weapon. If there are multiple weapons that are shot or multiple shooters, it can detect that. But it will also make sure that it's integrated with our Motorola CAD system so that if an incident is not reported to the ECC or dispatch, we still have a response to those incidents. And so MNPD will automatically be dispatched for any incident, gunfire incident that occurs in the 3 square mile areas where we'll be covered. The research has shown that only 20% of gunfire is actually reported by the public. And so the other 80% goes unresponded to, and we hope to create a safer environment by creating an environment that's responsive to when gunfire happens.
All right, and I guess the last question, because I know there's been some concerns about surveillance and other things. Is this one of those things that has been talked to those areas, and do they understand what's coming?
We will be having some community engagement meetings. There's no video surveillance with this. It's just strictly audio detection and sensors. But we will be having community engagement meetings because some of the buildings that will be needed will be privately owned, and so we'll have to engage private property owners, get permission and easements to actually place equipment on their buildings, and ShotSpotter will be coming in to help lead and facilitate some of those meetings.
Okay. All right. Thank you.
Thank you,
Mr. Matthews. And then I have a question for, I guess just an overall question for the police department. This is on the mobile data computers. It's a phase 2 of it's part 2 of a 2-part phase. It's $4 million. I'm just trying to remember exactly how much we spent the first time.
$4 million.
Was it $4 million? So this is $8 million. And again, could you just explain what this is for?
Sure. So the MDCs are the mobile data computers that are mounted in all of our patrol vehicles. It's kind of the epicenter that of the vehicle that officers use to write reports, print tickets, respond to calls via CAD and that sort of thing. It also is going to be utilized with camera equipment, in-car camera, and both body-worn camera, but irrespective of those uses, we still need to update this equipment. It's very old. And so this money will go towards the mounts, the computers, the keyboards, the printers, the routers, all the associated equipment to make that work.
Will this take care of the entire police department? Will it take care of what we need?
This was originally set up for 720 vehicles. There's actually, because of an increase in fleet, there's about 870 vehicles that we project we're going to have to install equipment in. So there's probably, there actually has been an additional request made to fiscal for $1.6 million to cover those, that new addition to our fleet.
Okay, so there'll be a third phase to this?
Yes, sir.
Okay, all right, thank you.
Thank you.
And Madam Chair, my last question goes to the Public Works Department, and it deals with the annexation, dealing with carts, $845,000, and the salt bin relocation, which is $500,000. Just trying to figure out how many carts we're ordering and whether these are brand new. We didn't have any, and interested in the salt bin relocation.
Councilman, this is Sharon Wallstrom with Public Works. That number is going to buy about 16,250 carts. There'll be trash carts and recycling carts, and this is brand-new carts that will go into that area to be distributed to the homes in the annexed area. The salt bin relocation is going to move from the West Center over to the East Center. The West Center is on Charlotte Avenue, and right now that property is being considered for sale.
So I guess the question is, why is that property being considered for sale?
That is something that the administration has looked at, and the fire department and Public Works are on that property, and both are looking at relocating.
So I guess my last question would be, if it doesn't sell, why would we relocate?
At this point, that salt bin after the last snow is basically done, and the East Center is where a lot of our equipment is also located, and Central Nashville, and the East Center is closer to where some of our trucks in Central Nashville are.
Okay, all right, thank you.
Thank you.
Thank you, Madam Chair.
Thank you, Vice Chair. Councilwoman Weiner.
Thank you, Chair. I appreciate it. I would like to speak first to the fire department, please. If we can call somebody up. I have talked to you way too much recently, and I cannot even begin to thank you on behalf of the people that live in Creekwood for everything y'all did. Having witnessed what you do firsthand that night, we had, what, 2 ladder trucks? 3 ladder trucks?
Yes, 3.
Okay, what happens if another fire were to have broken out that night? How many total ladder trucks do we have?
Well, we typically have 12 ladder trucks, and we have 5 as reserves. But when we lost one during the ice storm, now we have 12 and we have 4 in reserve. So due to our fleet, of course, the aging of our fleet, we do run into situations where our ladder trucks are one of the ones in particular that always are breaking down, so we are in desperate need of fire trucks.
So in terms of the ladder truck, the frequency with which they break down annually might be what?
Well, that'd be hard to actually say. I mean, because a lot of the equipment is older, and those trucks go through quite a bit of abuse. I mean, as far as us running with the call volume. So we've voiced our opinion and our concern about our equipment. And, of course, the ladder trucks are one of the things that we're really trying to express our need in.
So the situation as it stands right now would cause how much of a delay if, God forbid, that night there'd been another fire? I mean, you also have to man that truck, right?
Oh, absolutely. In our coverage zone, a lot of times we'll have that mile to mile and a half coverage, and if one of the companies are involved into another call or we don't have that piece of equipment, it will affect our response time. And of course, as you know, seconds save lives, and so we was just very, very fortunate that that night we had the equipment that we were needed, and the guys did an outstanding job actually stopping the fire. And again, we was very blessed that no one got injured or hurt. But I am very honored to be a part of the Nashville Fire Department and as a director chief because they make me look good. But there are a lot of brave men and women, both EMS and fire, that do an amazing job every day.
And there's also a grateful puppy dog.
Absolutely.
That was recovered
we did save
as well.
a dog, puppy dog, absolutely.
In a perfect world, how much money do you need to fix the fleet and get us up to where we would have minimum standards to move forward in the best practices methodology?
Well, I think I spoke with Nancy Whitmore, who's over the fleet, and she has a little bit more broken down in a different way that I would actually say it here. But we probably need anywhere, I think, if we were going to replace the fleet that is ready to be replaced, it's about 20 million, be honest with you. But, you know, as far as our fire trucks, I would be very happy if we at least had, 3 to 4 more trucks.
Okay, thank you. I appreciate it.
Thank you.
Okay, next, I would like to speak with the arts folks. And I only have one question for Ms.
Do we have Ms.
Cole.
Cole?
Yes, ma'am.
Could you be specific about the 50,000 and where it would go?
I would like to. Generally, what we have done, our practice has been to come to council for 4% every few years and draw that down as we have routine maintenance. Our 1% for art fund does not allow us to do routine maintenance like removing graffiti, tagging, minor repairs. And so I generally don't know what those repairs are until they happen. So we do have everything cataloged and sort of we manage that. It took us 2 fiscal years to draw down $50,000 on our collection. And just to be clear, that's on the art that the 50 some odd pieces that Metro Arts manages, not other art that may be owned by other departments.
So this may not necessarily get used if we don't rise to the level of the $50,000 repair fee.
Correct. Generally, this 4% money has lasted us a period of, of years. Yeah.
Okay, thank you.
Yeah.
And let's see, municipal, please.
You're on.
Thank you.
Yes, ma'am.
Could you speak to the specific restroom repairs and more so than that, renovations? Were the renovations in general or renovations to the restrooms?
They're renovations to the restrooms. I've got some photos here if you want to look at them. We've got the original fixtures for the faucets, for the toilets. Can I just bring those to you? You want to look at them?
For the sake of the other committee members, please
gonna pass it
illustrate.
around.
Yeah.
So is this to fix all of them at once? Are we going to stage this?
All of them at once. This will take care of the restrooms. Yes, ma'am.
Okay. And are they not functioning, or is it just that?
They're functioning, but they're breaking down occasionally here and there. So it's getting to the point where it's going to be patching up a wall instead of just kind of taking care of them all at once.
Okay, if you had to prioritize this list, what would your priorities be?
That's a good question. Prioritize as far as doing the restroom repairs or putting in including the Hall of Fame Museum and the electric
Yes.
Fort Lips.
Yes.
Okay. If I had to prioritize, I would probably go with the Hall of Fame Museum repairs and renovations first, just because you're dealing with some leaks sometimes in there as well, and that kind of deals with those. And there's a lot of precious things down in the Hall of Fame Museum, and so I wouldn't want any of those to get hurt or damaged. So I'd probably go with that one first, and then. Yeah, and then probably the restroom repairs and then the forklifts.
Okay, great. Thank you. I appreciate it.
Yes.
And HR.
Ms. Hall.
Council Lady.
Hi, thank you.
Hi.
Can you just speak to this I'll spit this out, the specifics of what you would like to do and why.
Yes. We have 2 training rooms at Metro Southeast. This is where we conduct the bulk of our trainings, well over 600 a year for all Metro employees, supervisors, managers, et cetera. Right now, it is very hard to see and to hear the things that we are detailing in our training. So it would allow us to have the orientation of the room is a little weird. So it would allow us to have 2 screens that be angled so that people can actually see the visuals of the training. And I'm speaking obviously to utilization, which is primarily by HR, but we do allow other departments to use those as trainings. And then also a sound system. I think there could be a small argument made that from a audible perspective, it's kind of hard to hear, also because of the orientation of the room.
And speaking of the audibility, is the room accessible for looping for somebody that might have a telecoil that needs that additional direct input?
I'm not sure if it is now or not.
You may want to check that for ADA.
That'd certainly be our intent, so.
It's not expensive.
Yeah, that's even better.
Okay, I appreciate it.
Of course.
Thanks.
Thanks.
That's all I had.
Thank you, Councilwoman. Councilman Glover, did you want to be recognized for HR while she was up?
No, Madam Chair. Actually, I was wanting to be recognized at the end to talk to the Finance Department.
Okay.
Thank you.
Councilwoman Dow.
Thank you. I just have a couple of questions, and this one is directed at either John Cooper or Talia. I was curious about with replacing the fire truck. Is that the same process we go through when we replace police vehicles when they're damaged?
It's out of the same funds, yes.
So it's out of the same funds?
Yes, ma'am.
Okay. I was just curious about that. I know Rural Hill Road because I actually live off Rural Hill Road, and you'll have some zoning legislation coming maybe at some point, but I want you to keep that in mind about that truck falling over and flipping over. It's a very dangerous road, very dangerous. But I do have another question. I wanted to ask from the community office about the shot spotter. I would like to know how they determine what area to implement this shot spotter program, an alert system.
Mr. Matthews? Oh, he's coming.
Yes, Council Member Dow. We looked at the areas that had the highest rise in gun violence over the last year, and those were the top three areas in the county with the rise in gun violence.
Okay, now with this new, because I actually saw this demonstrated at one of the conferences. Now, will it require any additional police resources as far as like more than what we have now to respond to it?
You want to speak to that, Chief?
Deputy Chief Damian Huggins. It's a collaboration between MDHA, Metro Government, ShotSpotter, ECC, police. What will happen is it'll be implemented into the areas. The units that respond to those areas or have a responsibility for zones in those areas or districts will have the ShotSpotter software applied on their systems. ECC will also be able to dispatch it just like a call for service when there's a shot, but the police officers will get it and it'll direct them to the location, give them audio. If there's a camera associated with it, it will also provide the ability maybe for video, depending on the circumstances. But from the resource side, it'll require this response of the police officers that we currently have in the area.
So you're saying no additional resource needed to respond to the implementation of the shot spotter?
That's correct.
Okay. Have you talked with any of those groups that are discussing, over patrol or anything with regard to the shot spotter? I was just curious.
Yeah, I've had a conversation with some of the leaders at Gideon's Army, some of the leaders that are looking at violence interrupter models, and we talked about how this could potentially be used by those groups also in terms of just being a responsive community, not always having to deploy police resources to respond to an incident, but also how we deploy community resources to respond to incidents also when gunfire happens, and dealing with things like counseling in the community, or if any trauma is experienced, do we have trauma-informed care specialists that go out into the community also and work with that community after incidents happen. So we are having those conversations about how this tool could be utilized just beyond law enforcement itself.
Okay, well, that's good to know, because I know we get a lot of complaints about over-patrolling. I had one last question. It was from Metro Public Works about relocating the salt bin, and I was just curious as to why are we doing that?
you repeat your question again?
It's about the salt bin. I saw in here a line item. It says we're spending $1.48 million for carts, dumpsters, computer system upgrades, and salt bin relocation.
The salt bin relocation is about $500,000.
So why are we, what are we doing? Why are we moving it? Why are we
The
relocating
salt
it?
bin over at West Center, we're looking at relocating that over to the East Center. The trucks that go out from the central location downtown off of South Fifth, and we can have double salt bins at the East Center. It'll be closer for the vehicles.
So does that take away from, I know we have one out in our southeast Nashville area.
That one's going to remain.
Okay. So the consolidation is why? Because I think before we came up with funds to locate salt bins and distribute them throughout the community with the, I think it was said that we need to put them in different locations to better respond to, weather when it happens and not have it centralized. So I was just trying to understand, why we would move the west bin to the East Center.
We weren't able to find another piece of property over on the west side of town, and the east is where we did have property, is the one that's the most centrally located for those trucks. Right now, they're looking at the potential of moving Fire and Public Works off of that property on Charlotte.
Okay. Is it because I guess that property now is more valuable, I guess, from that? Okay, I got that. And are these carts, is this for new people or replacement carts? Are we still charging people for?
It's for new people for the annexation. We've got about 9,000 residences out there. So this will cover the trash and the recycling because not everyone requests a recycling cart.
Okay. Do you know the address of the current salt bin location that's out west on Charlotte?
I do not.
Okay. Can you get that to me?
Sure can.
Thank you. That's all. Thank you, Chair.
Thank you, Council Lady. Council Lady Allen.
Thank you, Madam Chair. Could I get Ms. Cole back up from Arts one to follow back up on the question about repair of art, which is a subject near and dear to my heart, as she knows. Can you expand a little bit on the difference between the 1% art fund and other art that may also need repair and how we can provide a sure source of funding for that, or where we are in that process?
I will try.
Thank you.
So the 1% for Art Fund is capital, and it's based on bond. So we cannot use it for everyday wear and repair on small things, only large-scale capitalized maintenance. Historically, that 1% fund is only applied to art that is in the Metro Arts purview, so art that my department facilitates and brings into the world, not art that may have existed in the coffers of Metro prior to there being a public art fund in 2001. We have, in the capital budget last year, you funded a study that we have completed, sort of assessing the other art that may be owned by Metro departments and its core condition, to try to get at what would the ongoing recurring maintenance monies that we might need to support the art repairs in all of Metro beyond just our department. I have a meeting later this week with the finance department and some of those departments to sort of share that report and then move forward on, I think, hopefully a solution that would be getting everything under kind of an ongoing maintenance repair program. I hope that answers your question.
Yes, and would that possibly be funded out of 4% money for everything at that point, or would it be a different fund?
I believe that is an option on the table. I think what is probably not an option for some of those routine maintenance is bond-based funding. That's sort of, because most of what we're dealing with when we're talking about art repair and maintenance are the everyday things that add up to big problems over time when they're not addressed. Your dragon.
Right. Yeah, for example.
So sort of things that need, if they are on a routine maintenance, like we clean the graffiti or we re-wax things or we do X, Y, or Z, if that is happening, then we can, for most part, avoid major capitalization of repairs. So I think that's the ultimate goal. I think there are some internal conversations that still need to be had before a solution would be put forward to this body.
Great. Thank you for your ongoing work on that. I appreciate it.
Thank you.
Thank you.
Ms. Cole, before you leave, Council Lady Henderson, did you have any questions for? Okay, thank you.
Okay.
Council Lady Henderson.
Thank you, Chair Vercher. My question was for Parks and Rec, please. Hi, Director Odom. I'm looking here at the $500,000 for community center furniture, appliances, fitness equipment, and supplies. And I wondered if that was particular to one community center or across our park system. If you could just speak to that, please.
This request is, well, good evening. This request is particular to the newest community centers that are scheduled to come online this spring. That's Madison Regional Community Center and Smith Springs Community Center. So it's particular to those two community centers.
And I apologize. I know Smith Springs is brand new. Madison, I apologize. Is that a renovation?
It will be it'll be a new center. The old one will be torn down, and Madison is expected to be at substantial completion at the end of March, and then Smith Springs at the end of April.
March and April. And then can you speak to, just from a budgeting process, as far as capital budget, when you do a new community center, are you factoring in for furniture, appliances, and equipment, or, I guess, is this...
This is routine. This is typically what we have done in the past when new community centers are being built or rehabbed and are coming online. They are included in our 4% request. This was included in our annual 4% request that you approved back in July. So, yeah, that's what we routinely do.
Thank you very much.
You're welcome.
That's it, Chair Vercher. Thank you.
Thank you, Councilor Henderson. Director Odom, I have a question. For the other community centers, it's just labeled as other community centers. Have we identified what community centers that entails?
We have not. There is an in-house priority list, but we have needs across the system in those centers. And while there are some higher priority needs, we will use this, like I said, across the system. And those needs become apparent throughout the year.
Thank you so much. Council members in the queue, these are for Director Odom. Councilman Sledge.
Thank you, Madam Chair. I'm not on the committee, but I had a quick question that follows up on the fitness centers. Can you give me an idea of what happens next step? We appropriate, then do RFQs go out for procurement on those?
Yeah, when the funding is available, we'll move forward. There are very likely, and I'm sure there are already contracts and vendors in place to purchase these equipment and supplies. So it'll be a go.
Just one. Thanks.
Thank you, Councilman. Councilman Pridemore.
Thank you, Chair. Thank you, Director Odom, for being here. Considering the condition of the Madison Community Center, would you mind elaborating on what year it was built? Or I can tell you.
Please tell me.
1963.
I figure, yeah.
And there was one piece of exercise equipment that was donated by the Nashville Knights hockey team. So that tells you how long that equipment is, and it's one piece of equipment. So, thank you.
Madison is probably, I know it is one of our community centers that has needed, or one of the areas that has needed a new regional center for a long time. There are others in the system, but I know this one has been on the waiting list for a long time, and we'll be glad to see it come to fruition this spring.
Council Lady Dow, are you seeking recognition for Director Odom? Councilman Glover.
Thank you, Chair. Yes, I am. I want to make sure. So the Madison Community Center, was that in the capital spending plan, and now this is additional money? I'm sorry, I wasn't quite following the sequence of the money trail here.
Director Odom.
Yes. The community center was in the spending plan. The equipment and supplies was included in our 4% request, annual 4% request.
Okay. So, because I have to protect our side of town as well. We've got a bunch of property out in the Donaldson Hermitage area we've done nothing with. When are we thinking we're going to do something out there? Because we own hundreds and hundreds of acres, and we're just sitting on it.
There is currently a master plan that has just been completed for that area. The large, used to be Ravenwood area, that's in the works for that area, and it will be in the capital spending, in our capital spending budget request.
Capital improvement or capital spending?
Capital improvement.
Okay. Well, I hope we do that because we've owned that property for a long time, and I guess my real question is, Madam Chair, if we're not going to end up utilizing that property, can we put it back out for sale, because things are going pretty hot, and we can actually get our money back, I believe, if we're not actually going to start utilizing it. Thank you.
We are going to start utilizing it.
You got a commitment from the director. Thank you, Councilman Glover.
Thank you.
Councilman Hager for Director Odom.
Am I on?
You're on.
I'm assuming that I'm in the capital improvement budget for the Old Hickory
You are.
Community Center.
You
Thank
are.
you.
You don't have to do your bidding now, Councilman Hager. Seeing no further discussion, all in favor?
Another question.
Councilman Glover.
No, this was why I asked to come to the very end. So here's my question for finance. All right, so we're sitting in February. Do we anticipate another 4% request prior to this fiscal year being completed?
Yes, we do. I anticipate bringing up another recommendation probably late March or early April.
Okay. And do you have any idea of what that monetary number is going to look like?
We don't know what that is now. That's why we're waiting for the primary collections will happen in January, February with the property taxes.
Okay.
So that's why we'll have to wait for those numbers to come in.
Okay. Thank you, Chair.
Thank you, Councilman. Council Lady Dow.
I'm sorry, I just had, this salt bin moving, it just doesn't sit right with me. I want to know, does anyone back there at the table owns the property on Charlotte, and when we vacate it and move, what's going to happen to that property? Is that Metro's property? And $500,000 is a lot of money to spend relocating things. So I just want to know, if we own that property, why are we doing it, and what's going to happen to the property? Will it go in surplus? And if it's going in surplus, what are we doing with it? Are we putting affordable housing there? What's going on?
That property is, I think the address is 3800 Charlotte. 3800 Charlotte, and we have been.
I didn't hear because Jeremy L. Robb.
3800 Charlotte.
Yes, and we have been in contact with Council Member Murphy regarding where we think we're going to move in that direction. But right now, we're thinking that property would be disposed of.
So we're moving it because we are going to sell the property. Is that it?
Yes, but then there are also business reasons, as Ms. Wallstrom discussed, in terms of why the other location might be good for operations for Public Works.
Okay, so we're moving it because we're going to sell it and put something there. That's it. Thank you.
Thank you, Council Lady. Councilman Hastings, you're not on the committee.
Yes, I'm not on the committee, but just a quick question for the finance. It said that the Charlotte Avenue, or whatever the location is that we had it up for, we're going to probably sell it off. Is this something that has been in agreement with the council person for that area?
We have been in contact with the council member on this project and how it's been moving forward. And before any specific action would be taken on that property, it would be brought back to this council for approval.
All right, I just want to encourage you because we did do we did change the format before anything can be done, even before it gets up for sale. That needs to go to the council person that's responsible for that area. If not, it's going to bite back, and it's going to be something that is not going to be conducive for anybody on either side.
We are aware of that, Councilman, and we have been in constant communication over the past few months with the council member.
All right, thank you.
Thank you, Councilman. Seeing no further discussion, all in favor? Opposed? Resolution passes. RS 2018-1023, sponsor Virture, approves a major cultural institution grant from the Tennessee Arts Commission to the Metro Nashville Arts Commission to provide general operating support. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1024, sponsors Virture, Gilmore, and Withers, approves agreements between the Metro Board of Health and the Tennessee Department of State for the provision of administrative law judge. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1025, sponsors Virture and Withers, approves an amendment to a grant from the Tennessee Department of Labor and Workforce Development to the Nashville Career Advancement Center to provide reemployment and eligibility assessment services to help unemployment insurance claimants to return to work faster. Is there a motion? It's been moved and properly seconded. Vice Chair? Oh, seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1026, sponsor Virtual Roberts, accepts a donation from E3 Construction Services in honor of J. Dante Thompson for the use and benefit of the Metro Nashville Police Department's North Precinct. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1027, sponsors Kendall, Virtue, and others, approves a Transportation Alternatives Program grant from the Tennessee Department of Transportation to Metro Parks and Recreation to continue the 440 Greenway from Almond Street at Park Plaza to the 28th Avenue connector at Centennial Park. There is a letter from the sponsor, a letter to approve. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1028, sponsors Henderson, Virtue, and Roten, approves a grant from the Friends of Warner Parks to the Metro Parks and Recreation to assist in the funding of a fully developed engineering study to more accurately estimate the cost of restoration of the alley in Percy Warner Park. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1029, sponsors Virtue, Gilmore, and others, approves a grant from the Best Friends Animal Society to the Metro Board of Health for a Lagunitas sponsor Adopt a Shelter dog promotion. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1030, sponsors Virtue, Gilmore, and others, approves an intake diversion program grant from the PetSmart Charities to the Metro Board of Health to establish a safety net voucher program to provide low-cost medical services and behavioral vouchers to assist in decreasing the relinquishment of animals to the Metro Animal Care and Control. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1031, sponsors Virtue and Gilmore, approves an amendment to a grant from the Tennessee Department of Health to the Metro Board of Health to provide nutrition, education, and services to eligible women, infants, and children, and breastfeeding peer counseling programs for citizens of Davidson County. Is there a motion? It's been moved and properly seconded. Council Lady Allen.
Thank you, Madam Chair. I was just wondering if someone could explain why the decrease in that funding.
Madam Chairman, Tom Sharp from the Health Department. That is, the feds make that decision based on usage. That's about a $5 million grant a year. It's a relatively modest reduction.
So have we been able to reach out to people? Has it been a successful program?
Oh, yes, ma'am. That's the WIC program. It's the largest driver of business that we have.
I mean, it seems to be specifically for breastfeeding education. Has that been successful as far as that?
It has.
Okay.
In fact, yes.
So we're not pulling back or anything, or
no, they're
excellent.
very serious about that.
Just used our money well. That's great. Thank you.
Thank you, Mr. Sharp. Seeing no, did that answer your question, Council Lady? Okay. Seeing no further discussion, all in favor? Opposed? Resolution passes. RS 2018-1033, sponsor Virtue, authorizes the Metro Department of Law to compromise and settle the property damage claim of Ann Claire Hamilton against Metro government in the amount of $24,469.16. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1034. Sponsor Virtue authorizes the Metro Department of Law to compromise and settle the personal injury claim of Cantina Williams against the Metro government in the amount of $125,000. Is there a motion? It's been moved and properly seconded. Seeing no discussion, all in favor? Opposed? Resolution passes. RS 2018-1035 sponsors Virtue and Elrod, amends BL 2014-926, an ordinance authorizing a one-time subsidization of rain barrels for the residents of metro government and by allowing a yearly subsidization of rain barrels. And there is an amendment. You want to explain the amendment? Is there a motion? The amendment has been moved. Mr. Jameson, will you explain the amendment for the committee?
The amendment would change Section 1, delete it in its entirety, and state that the metro government acting by and through the Department of Water Services is authorized to subsidize the cost of rain barrels by paying $20 for the cost of the rain barrels, so through the program not to exceed $20,000 annually for residents. That is a slight change from the original provision.
Vice Chair, you have a comment on the amendment, or you want to wait to the bill? Okay. All in favor? Opposed? Amendment passes. Now we're on the bill as amended. Is there a motion? It's been moved and properly seconded. Councilman Vice Chair Schulman.
Thank you, Madam Chair. I'm just looking for somebody to explain what this program is. I think it was adopted originally in 2014.
Do we have someone from Mr. Honeysucker?
John Honeysucker, Metro Water. The rain barrel program is really just used to help with runoff and different things like that to preserve the extra water that's being ran off. It's an excellent program that the Metro Council, that the previous council adopted. And again, with this particular amendment, we're just utilizing the option. We'll still have the same contractors, but we just want to do this more on an annual basis instead of a one-time event.
Can you tell me how many rain barrels have been utilized so far?
In the 2016 program, the program subsidized 905 barrels.
And so these barrels are out at, I guess, at people's homes collecting water?
Yes, sir, at different locations throughout the county.
And is there a particular focus on the rain barrels about where they're supposed to go in order to help improve stormwater?
No, we would just try to utilize it in areas that may have a considerable amount of runoff throughout the community.
Okay, I guess that was my question. Is it pinpointed in a specific area to try to help in a specific situation?
Well, we usually try to look at certain geographical areas, but it's utilized throughout the county.
Throughout the county?
Yes, sir.
And if for some reason anybody's interested, should they contact the water department?
Yes, sir.
Okay, all right, thank you.
Thank you, Vice Chair. Council Lady Henderson.
Thank you, Chair Vercher. Mr. Honeysucker. My questions are similar to Mr. Schulman's, but I did want to ask if Metro subsidizes the barrels at $20, what is the cost to the citizen for a rain barrel?
What I'd like to do is ask if I can get Jim to come and assist me with that question. Right now, that's a question I'm not sure, but I'll be more than happy to find out the answer for you and get back with you.
I would be interested to know. I appreciate that 905 of them have been purchased or used. But I guess my question is similar to Mr. Schulman's in that may any citizen avail themselves of this opportunity?
Yes,
or
ma'am.
Okay.
Yes, ma'am. It is open to all the constituents of Davis County.
Okay. Thank you.
Jim Snyder, Metro Water. Council Lady, I think the total cost is $55, but we'll need to verify that for you.
Okay. Thank you.
Thank you, Council Lady. Seeing no further discussion, all in favor? Bill passes as recommended. I'm sorry, as amended. Bill 20, now we're on bills on second reading. BL 2018-1054, sponsor Virtue, amends the Metro Code regarding leases of surplus property. I'm going to going to defer this for one meeting. This is my bill. I'm still working on it. Wanted to provide you that explanation. So still working on the language. Council Lady Allen posed a valid question as it relates to this legislation. So I would like to request a one meeting deferral. Councilman Glover.
And Council Lady, that's fine. Mr. Jameson, is this pending legislation now?
This would be on second reading. It's being deferred, so no.
Okay. So I guess the question I'm going to ask is, as I read this, does it open a window up that something can happen in the city until we actually get a handle on where we are with regards to property being leased for a long amount of time.
The current provisions of the code would apply, but this ordinance would not apply, obviously, until passed, and it has no pending legislation effect until considered on second at earliest.
All right, thank you.
Thank you, Councilman. Was my motion seconded? Second. Thank you. Seeing no further discussion, all in favor? Aye. Opposed? Bill is deferred for one meeting. BL 2018-1055 sponsors Glover, Gilmore, and others. Amends Metro Code regarding agreements between Metro and the Metro Hospital Authority. There is a letter from the sponsors to be deferred. Is that one meeting? To be deferred one meeting. No, I'm sorry. That's RS 2018-1055. My apologies, Councilman. Thank you for catching me. It's been moved and I need a second. I'll read the caption again, Council Lady. BL 2018-1055 sponsors Glover, Gilmore, and others, amends the Metro Code regarding agreements between Metro and the Metro Hospital Authority. And there's already been a motion. It's been properly seconded. Any discussion? Seeing none, all in favor? Aye. Council Lady Henderson.
Thank you, Chair Vercher. I wonder if Mr. Glover's sponsor could just speak to his thinking or reasoning on this bill, please.
Councilman Glover.
I think when I filed this originally, the thinking was that a lot of things are happening inside of the city that we really don't have complete answers to. We don't understand exactly what the cost would be if we closed the hospital. I think certainly over the last week it has expedited and kind of taken me to a stronger position on the fact that we need to take our time. We need to understand exactly what we're doing. And so therefore, what this bill is simply saying is we won't close the hospital for June 30th, 2019 as far as inpatient services are concerned. I think we've got a bill that we moved to the Hill. We're going to talk about the funding here in a few moments. But right now, given the complexities of the city, the amount of money that's being spent in a number of areas that we question, I think that the major thing that really made me file this bill was when I read in the Tennessean that the hospitals throughout the area were waiting to see what the contingency fund looked like. And so that's when I said, well, wait a minute, hold on. When I asked the question, what's our stop loss? How much money exactly are we going to have to spend if we close this? And I got no answer. So I'd rather know exactly what I'm dealing with right now as far as what the cost may happen to be versus what the cost could be as we go forward. So that's the reason for this, just to say, let's step back, let's take a look at things. I think the mayor's already stated that they're not going to do anything before December of this year, which will automatically move us into the next fiscal year. So I just think we need to be prepared, and we collectively need to take our time, understand exactly what it is we're doing, and what exactly we're trying to accomplish. So that's the primary reason for the bill.
Thank you, Chair Vercher. That's helpful. Appreciate it.
Thank you, Council Lady. Councilman Mendez.
Thanks, Chair. I don't know, maybe Mr. Jameson's the right person for these questions. Trying to figure out what, if any, new obligations this gives, and specifically, I don't think that an agreement between Metro and the hospital could be terminated without our approval. Is that right?
That's correct. We also have several agreements between Metro Hospital Authority and Nashville General Hospital and Meharry, most of which date back to 1999 and run through, I believe, 2024 and perhaps longer. I think a lot of them didn't actually commence until buildings were occupied and so forth. This would not do anything to retroactively affect those contracts. It would simply state, to the extent there are new contracts entered into, they would require inpatient services but termination requiring council approval is required.
And so for A here, which would require new agreements, we'd have a chance to approve that anyway. And if B is something that needs to happen anyway, the way I'm sort of looking at this is, and people could argue whether it's useful or not useful, but it's essentially a restatement of the way the world should work anyway. Is that right?
Correct.
All right. I mean, to the extent that it restates that council would have to sign off on the terms of any new agreement, and that the council would have to sign off on the termination of an agreement with the hospital authority. I mean, I don't mind passing it because I think it is a statement of our intention to be involved as a body. But I think it is important to know that it is more a restatement of existing obligations more than anything else. Thank you.
Thank you, Councilman. Councilman Glover.
Yeah, and Madam Chair, and thank you, Councilman Mendez. I think the other purpose of this, and to the council lady who asked me the purpose of it, I think the other major thing that it sends a message on is giving the hospital, the staff, and all the people involved over there is stability right now as we try to figure out the complexities of this issue and determine what is the best way we go forward. So thank you for bringing that up. I think that, I think that's an important message that I failed to mention, Council Lady Henderson, and so thank you guys.
Thank you, Councilman. Council Lady Weiner.
Thank you. I just want to reiterate my support for this, specifically because it offers us the time to put a pause on this. And you'll see at the Hill when we address this issue again that we need to put together a stakeholder meeting for strategic planning moving forward, and this will give us the space to do that. Thank you.
Thank you, Council Lady. Seeing no further discussion, all in favor? Aye. Opposed? Bill passes. BL 2018-1057, sponsor Vertran Elrod, amends the Metro Code in regard to the solid waste generator fees to clarify fees due upon landfilling, construction, and demolition waste. Is there a motion? It's been moved and properly seconded. Council Lady Weiner, are you being recognized on? Okay. Seeing no discussion, all in favor? Aye. Opposed? Bill passes. Now we are back on RS 2018-1032, sponsors Vertran Gilmore, appropriates $13,231,000 for the benefit of the hospital authority, and $4,409,676, of which will be paid directly to Meharry Medical College for services provided at Nashville General Hospital through June 30th, 2017. It's been moved and properly seconded. I do believe we have some, we have some substitutes.
Amendments and substitutes.
Councilman Cooper.
Thank you, Chairman. If you didn't mind, and with Mr. Jameson, if you would explain the process going forward, numerous substitutes, what order we'll be taking them in, if you didn't mind just helping us get organized.
Sure. I might suggest that if we took them in the order in which they appear in your packet, that's the perhaps easiest. The first one that it should be in your packet, the sponsors are Council Members Weiner, Mendez, Rosenberg, and Schulman. Just to note the highlight differences between the amendments and substitutes. This one, the principal amount would remain at $13 million, and I'll just use round figures if that's appropriate, but would essentially eliminate the impoundment provision of $2.4 million. All $13 million would be from the undesignated fund balance. That would change the below 5% fund balance policy, leaving the balance from 3.85 as under the original resolution down to 3.6, and would eliminate the hiring freeze reference, and lastly create the oversight committee that Councilor Weiner referenced previously. That is the first amendment in your packet. The second amendment in your packet is by Councilman Mendez. That is essentially contained in the one I just read to you and has been added to. My assumption is that he may not be offering that one now that the first packet is in. The third in your packet is actually a substitute from Councilman Schulman. That would increase the $13 million total to the hospital authority to $19,700,000. The $4.4 million going to Meharry remains the same, but you now have $15 million left over, $4 million of which would still go to patient reserves, but now a much larger fund, $11.2 million going to operating expenses. It would likewise eliminate the $2.4 million impoundment, with all $19.7 million coming from the undesignated fund balance. It would likewise eliminate the hiring freeze and likewise establish the oversight committee. The next amendment in your packet from Councilor Weiner, again, I suspect she has wrapped that into the very first amendment in your packet. Councilor Henderson has a question.
She needs to reference the substitutes.
So we are on the fourth one in your packet, and you'll see the only sponsor of it is Councilor Weiner. And in the caption, you'll see that this would increase the total allotment to the hospital authority to $20 million from the $13.2 million. That would leave, after the allocation to Meharry, that would leave $15 million. The $4 million still being used for the shortfall in patient revenues, but $11 million being dedicated for operating expenses. That does keep the impoundment, but keeps the remainder of $17,600,000 from the undesignated fund balance. This was the initial substitute that established the oversight committee. Again, I suspect that she is now wrapping that up into the very first amendment in your packet. Councilman Sledge has 3 substitutes, and because he was the author of all 3 and they were essentially very similar, those were labeled A, B, and C. Those are the last 3 in your packet. The primary difference is the total allotment. In substitute A, it's $11.3 million. That comes from the undesignated fund balance, eliminating the $2.4 million impoundment. The $2.4 million impoundment is reduced for a total of $550,000, with the remainder coming from the undesignated fund balance. After the payment to Meharry of $4.4, you're left with $6.9 million to be used for $4 million for operating, or rather patient revenue shortfalls, and the remaining $2.9 for operating expenses. Councilman Sledge's substitute B, the total allocation is $11.6 million. The $2.4 million impoundment is eliminated. $4.4 million of that still goes to Meharry, as it does in each of these. That leaves $7.2 million left, $4 million of that to the patient revenue shortfalls, the remaining $3.2 used for operating expenses, and the remaining $10.8 all comes from the undesignated fund balance. The last one from Councilman Sledge, substitute C, identical in most all respects, except the total allotment is $12,231,000. Again, 4.4 of that going to Meharry for the amount owed. That leaves a remainder of 7.8. Again, 4 million of that used for the patient revenue shortfall, leaving a remainder of 3.8 for operating expenses. The impoundment that was at 2.4 is reduced by 1 million, is now 1.4 million, and the remaining 10.8 million is from the undesignated fund balance. I think I would recommend to the chair that the motions be taken as they are introduced by sponsors, because some of these will not be introduced, I suspect, by sponsors.
Thank you, Attorney Jameson.
Councilman Glover.
Just very quickly, Mr. Jameson, if you would, let's go back and I'd like before we get into the substitutes here, I want to make sure I understand the numbers and where we are with regards to where the money would come from. So let's take the first substitute, the 13.2, where it basically says we're going to take that out of the undesignated funds. And I think there's 4 sponsors on that one, correct?
Correct.
All right. And then there's Councilman Schulman's that says we're going to do 19+ million, and that's also out of the undesignated funds, correct?
That is correct.
Okay. And if we adopt either of these two, where exactly do we land with regards to the percentage left in our what I'll call the rainy day fund?
Right. So I guess to put this in perspective, the original resolution, as unamended as it appears on your desk now, all of these acknowledge that we're going to be coming below the 5% fund. And Finance Department has made clear in the whereas recitals that it'll be their top priority to restore that to 5%, as all of the amendments retain those recitals. So for the first amendment in your packet, whereas we go from in the original from 3.85 from 5%, the First Amendment in your packet, it goes down to 3.6%.
Okay.
For Councilman Schulman, it is it'll be larger than that. I don't have the calculated fee in front of me, but we will be substantially below 5% across the board for all of these.
Okay. So let's go back in and I'm going to ask Finance this question, please. The $11 million we built into the budget last year for projecting out to put into the rainy day fund for future expenses, what does this do? I mean, where's that money being counted right now, and what would it do if we in fact do these substitutes, et cetera, and then we go on with where we are? The $11 million. Does it come into play at all, or does it not come into play until we finish this fiscal year?
Okay, I can take that. If you recall, the amount that we put in the budget as a reserve, it was a reserve for debt service because of the capital budget needs. And we are expecting to bring back a bond resolution to the council before the fiscal year is out.
Or how much?
We don't know, but we're going to have to take out some commercial paper before the end of the fiscal year. And that funding, to cover the costs for that, it will come out of that debt service reserve. So that funding is not available for this supplemental, and it is not being used to calculate into these percentages. And I do have those numbers in front of me if the council would indulge. I asked staff to prepare what would happen to fund balance under each of these amendments.
Okay.
As originally submitted, fund balance would be at 385. With the First Amendment that was discussed with the 4 sponsors, it would go to 3.6. With the first substitute from Councilman Schulman, it would go to 2.9. The second proposed by Councilman Schulman would go to about 292.
Okay. So, Madam Chair, if you'll indulge me for just a minute more, because I'm trying to recall exactly what state law states. I realize our charter states that we asked that we not drop below 5% in our reserve funds. I'm trying to remember if state law says that if we drop below 3.5 or is it 3%, that we no longer can draw off of that for operational purposes as we go forward. And I don't remember that exact percentage, but I think it's one of the two.
Attorney Cooper.
The 5% is a policy that the council has adopted. That policy is provided to the rating agencies, and so that is our public statement for what fund balance should not be below 5%. That is policy adopted by the council and by the Finance Department. There is no state There's no state law requirement for fund balance for local governments except for schools.
Okay,
And
that's what I'm remembering.
Schools has a 3%. You can't go below 3% without board approval.
Okay, that I knew there was 3%. I couldn't remember what that was. Thank you, Chair, for indulging.
Thank you, Councilman. Vice Chair Schulman.
That was my mother. I'm sorry. I have, well, I guess a series of questions, but maybe I'm trying to make this easy. We're trying to figure out what to do, and obviously we have a series of amendments. Sounds like we have a couple of different questions. One is how much money are we going to put into this? Do we put in 13.2? Do we put in something less? Do we put in 19.7? Do we put 20 million? Then there's a question about where does it come from? Do we take it just from the undesignated fund balance, or do we do other things as well? And then there's this oversight committee. Now, I'm trying to, maybe I'm being more simplistic than, because I know there's different amendments, but I'm trying to get into the discussion so we can actually figure out which is the right amendment to put on this thing, so we don't keep taking them up and then passing one over the other. So I'd be interested to see if we could just go ahead and start asking questions, if that's okay.
Absolutely.
And then figure out where do we go. I do have one question, and that is, can you actually, in this bill, actually split the money so that you can actually designate it and give them a certain amount now and then give them some money later? Is that possible in a bill like this?
Director Lomax.
That's exactly how the bill is crafted, in that we would provide them funding not just at one time at the beginning, but based on cash flow and monitoring. And we've put in some specific provisions for them to provide us reports along the way to transfer the money.
Okay, but and thank you for that. But I guess my question would be: let's say that we did give them $20 million. Does that fit into the same scenario? We can do the exact same thing.
Yes.
Okay.
Yes, regardless of whatever the value is, you can have those controls in place.
Okay. All right, thank you. So, Madam Chair, I don't know, I'm trying to make this easier for everybody and just start asking questions, but maybe it's better to take, I don't know if it's easier, and maybe this is a question from Mr. Jameson, to just move one of the amendments.
Sure.
So, okay, so how about if I move my amendment, my substitute, the 19.7? Okay, and if you want, I'll give you a page number. It is on page, it starts on page 20. So I would make that motion just for purposes of discussion.
It's been moved and seconded.
All right. So what I would like is for somebody from General Hospital, their representative, to come up and explain why they need the $19.7 million. And then I would also, in the discussion, I think I would also ask if they don't get if they got 13.2 and didn't get the 19.7, what happens? Thank you.
Councilmember Schulman, shall we come to the front, or do you, because we have three people from
No,
General?
you're fine right there.
We're fine right here, okay. My name is Jan Brandis. I know some of you, and I am the chair of the Hospital Authority. Many of you I've gotten to know because you have been loyal supporters and advocates for the underserved and for those we care for at Nashville General. So I want to be very clear and tell you how much I appreciate the enormous work that you all have done over the past really several years. And you have provided us with much very important and funding that's allowed us to move forward and to get to where we are now. You all have taken an extraordinary, many of you have really taken an exceptional role in working to understand our mission and to understand our finances. Many of you show up at our Hospital Authority meetings. You have provided oversight, you have provided help, you have provided resources, emotional wisdom, and financial
really financial support, both directly and indirectly. And if it were not for many of you sitting in this room, Metro General would have already closed its doors. So with that said, and with much appreciation for what you have done, and for gratitude, and also to many of our staff and patients and our partner Meharry, we have to say that while we are very grateful for the amount that was offered and that we were promised the $13.2 million, the amount that we asked for was 19.7. And I think at some point in any discussion, you get to the point where you say, well, can we do this? Can we do that? The art of the deal, the art of negotiation, the art of how do you get something and take from that? And where do we put this and where do we put that? I am not a politician. I was asked to serve on the hospital authority, and then the board elected me as chair, and I think they elected me because I'm someone who says what I think, and I try to mean what I say. We are not trying to do anything funny or unusual or clever or in any way do anything that obfuscates what our needs are. We have made mistakes. We've made mistakes in our revenue cycle, which we've sat in the front, and you all have pointed them out. We've acknowledged, and we've fixed some of those. We have our chief medical officer, Dr. Dent, sitting in the back. He and Bruce Naramore and a whole revenue cycle team had really turned that component of our functioning around. But with and we had gone to the mayor's office on several occasions with proposals that had been discussed with Meharry. Dr. Hildreth and his team are here in support, and I think in the spirit of unity, we had come with several proposals after we did not get the $55 million we asked for from a zero-up budgeting process in May. We immediately worked on how we reduce those numbers. We met with Meharry. We met with the mayor's office. We met with some of you. There was a proposal, as you know, from the council, from you, about how to manage that discrepancy in function. We have continued to work on a month-by-month basis, and some of you have seen the document, and I don't know for certain, but I believe that part of this $13.2 million came from a review of a document that we would have been happy to submit had we not had the premature announcement, I shouldn't say premature, the announcement of closure. When that happened, it had an enormous impact on patients, on physicians, on nurses, on Meharry in all aspects, and on us. And when that happened, it changed our revenue stream. It changed our staffing. It has had an enormous and painful impact, and we do not believe that it's had an impact on patient care. But if we continue to juggle, if we continue to not speak the language of transparency and honesty, if we continue to not say this is a safety net hospital and on any given month you do not know exactly how many patients will come to you who do not need care. There were 2 letters to the editor in the Tennessean, I believe, over the weekend. I'm not sure of the date. But one of those was in support of our mission, and the other one said, I read it very carefully, and that person said in that letter to the editor, what's the big problem? These patients can go anywhere they need to go. We have plenty of hospitals. That is simply, we have plenty, it's not for me to determine whether we have plenty of hospitals. I think the flu season hospitals might disagree. But we do not have plenty of hospitals that will take patients who have chronic medical conditions and keep them. The law says that patients can go to an emergency room and be stabilized, but that does not count for the 4 major chronic illnesses that so impact Davidson County and Nashville. That's what our mission is. We certainly have paying patients, but we have many patients who are either uninsured or who are uninsurable. So I want to be very clear today. We ask for 19.7. It always becomes, or it has become since I've been involved with this robbing Peter to pay Paul. At some point, this council, because it seems to be that it's falling in your lap, that you are the ones who decide whether you want to live in a city that has a safety net hospital that is adequately funded. It's very, when we hear about trucks, fire truck, ladder trucks, we hear about equipment that the police needs. Everyone needs better equipment, but in medicine, if we don't have it in medicine, it absolutely changes our ability to deliver care. So I want to be very clear. We ask for 19.7 million because we need 19.7 million. We have Joel Sullivan, who's our finance chair, Joel, who is here. We have instituted a plan within the hospital authority. We review all the clinical contracts. We're looking at every dollar. And I'm going to stop in a minute because Bruce Nairmore and Dr. Webb want to speak too. But the hospital authority board is united. We have a plan that we voted on last Thursday in the middle of a lot of other things that are happening, but we voted on that plan as a proposal to move forward. It's not the overarching final plan, but it is a plan, and it is ready for you, and we will send it to you with a push of the send button. We are absolutely committed to letting you know what our finances are, to answering all questions, but I do have to say that we need everyone in this administration to be with us. This is not about sarcasm. This is not about rolling eyes. This is not about funny stuff. This is about taking care of patients and taking care of people who need them. And we serve as the index hospital for Meharry. And you see the dean of the medical school, Dr. Hildreth is here. We are in constant communication with them. We serve as the only training facility for their 12 OBGYN residents right now in terms of an index hospital here. The arrangement between Meharry and HCA is to place between 28 and 30 medical students at Southern Hills. That's something we applaud. We always want medical students to have great places to train. That does not negate the reason for Metro Nashville, for Metro General to exist. There is so much swirling around in terms of information. If you have questions about any of those arrangements or those proposals or how those young people are being trained, part of our mission is to prepare tomorrow's caregivers. Part of our mission is to take care of the underserved. So we need you. I moved to Nashville in 1983 to go to Vanderbilt to medical school. I had applied to medical school 10 years before that in a very rural state, and I couldn't get in. They asked me what I would do if I got pregnant during medical school. I was from a small rural town where one doctor took care of the African Americans, the white folks, and the Choctaw Indians, and anybody else that happened to roll along. That's who Meharry has trained for a very long period of time. So I remember what it was like. So I have a special place in my heart for the Meharry medical students and the residents. We have, I believe, I think Thomas Jefferson talked about the imperatives of education and health. If you don't have an education and you don't have health, what else really is there? And I would challenge this council to think about this in a different way. And I understand that the finance people may have a very different way of looking at this. But when we can have soccer stadiums and we can have ice rinks, and I'm not opposed to those things, but when we say we need $19 million, we can show you exactly where it's going. And if we don't spend all of it, we will either give it back to you or you tell us how it gets transferred into someplace else. But it's really time for us to quit futzing around as a community and be who we are, I think. But again, I'm not a politician, and I get you know, I'm from the rural South, so we never stop talking, right? But I would really challenge you. It's time for us to move on with this and quit debating and challenging and manipulating and trying to split Meharry in general. We have the same mission, and I know many of you sitting in this room believe in this mission, so we need it. Now, Bruce will explain the specifics about why we need it, but again, we also have not received any of the kinds of funds that we need for capital. It's a major issue for us. It's a constant issue. We had a flood in our surgical suites. We've had all of our operating rooms down for almost 5 weeks. We had 200 canceled elective surgeries. That's people who have esophageal cancer that nobody wants to operate on because they don't have insurance. So these are not just routine appendectomies. We need that money to take care of this community. We do have an overarching plan, and Dean Mallett's heading another group, to look at how we really can begin to change health care in this region for the underserved. We're not committed to only one way, and we want your input. We welcome any kind of oversight, any kind of additional input that you all want to have. But please, consider our request for $19.7 million. It was not made carelessly. It was not made without a great deal of thought, and that's what we need.
Good evening. My name is Bruce Nairman. I'm the Chief Financial Officer at the hospital. I think there were a few questions. Just a quick clarification. This $19 million does not include capital. This is just an operating supplemental request. We did request $2.7 million of emergency capital, but I don't think it was advanced. So to Dr. Brandis's note, this $19.7 million request is operating dollars only. What came forward was a $13.2 million from the mayor's office or from the administration, and some folks asked, what is the difference between the 13 and the 19? We were operating back in after the first quarter of this fiscal year with an estimated impact need of about $13 million because we had a very good first quarter in the hospital. And unfortunately, with the change, the announcements at Meharry and then the mayor's subsequent announcement, I projected, and unfortunately I probably underprojected, that our patient revenues were going to take a pretty big hit because just a confidence crisis, and our medical providers in the hospital might not be open after June 30th. So patients that have new onset cancer or long-term issues that they need to manage started going elsewhere for care because they're concerned that the hospital, I still have people that call that think the hospital is closing, has closed. They didn't hear the reset button that the mayor pressed. So we're still suffering. After November 9th, through the end of January, we've seen almost a 30% decline in our patient revenues, particularly on the inpatient side and our emergency department. That's, I have to believe I had projected it would be about a 15% decline. Through these first 3 months, it's been almost a 30% decline. We need, to Councilman Glover's point, we need public confidence back in this hospital to go forward. Dr. Webb, myself, the people that actually provide patient care, we spend way too much time justifying what we do rather than just taking care of the patients that we're charged to take care of. So the $13.2 million to the 19, that's $4.4 million of that increase is directly related to the drop in patient revenues, real cash collections. The other roughly $2 million was $1.7 million that we were going to use for retention or stay pay, which was originally intended to keep our nurses and radiology techs and so forth at the hospital through June 30th when we were anticipated to close. Now, talking to the finance director, when we had the request for 19.7 and her staff, we agreed that the stay pay dollars could be pushed into fiscal year 2019 because the dollars, although accrued, would not be cash paid until fiscal year 2019. So with that one exception, I think the 19.7 for this fiscal year cash needs is accurate. Unfortunately, I'm concerned that it's low because I projected a 15% drop in revenue, and it's been 30 for the first 3 months. Hopefully, the reset button will start to lift our patient revenues again, and Meharry's here showing their support for us. They've been with us all along. To Dr. Brandis's point, and the finance director and their staff, they know we have a cash flow report that we review every Wednesday. They know every dollar that we spend, every dollar that comes in. They see our accounts payable list every week. So there are not very many secrets, and they work with us well. I mean, we speak every week, and if there are things in between weeks, we text and send notes back and forth. So we're connected. And so I think Talia made the point earlier that if they advance $20 million, nobody's going to write us a check for $20 million. We're going to justify it, go through the process, show our cash flows, and then draw down money. I'm an accountant, too. I don't want to draw down money that I don't need. So believe me, to that point, if we don't need $20 million, we will not draw down $20 million. So
Thank you so much. We have a lot of council members in the queue, so need to get to where we can delve into the questions as it relates to the 19.7. Dr. Webb, did you have a comment?
Just in summary, I would say you've heard from the board chair and you've heard from our chief financial officer. And I would just say that the outcomes of the care that we're delivering is meeting our goals and objectives, and as well as our mission is to improve the population's health outcomes. And so if you are considering whether or not the funds that are being utilized at General are being well utilized, then all you have to do is look at the outcomes and see how well the staff and how resilient they are in their performance. And that's all I would say.
Thank you so much. We're still on discussion for the amendment. Council Lady Weiner. President.
So I have a question for finance. Talia, when we looked at the employee tuition reimbursement and the stormwater contingency and the other areas where you had shared that those monies have not been taken out, they've not been identified, they haven't been allocated, but you also shared that there are other departments that may have surpluses that we can also take from. Can you speak to that, please?
What I was sharing with her is that if you recall, the legislation had in there that the finance department would have to go in and work with the departments to identify $1 million of $2 million of additional savings, that we would be going back and looking at other saving opportunities and departmental budgets should this measure pass.
And the way this particular substitute is written takes us down to the 2.9%, even if they don't draw down the whole amount, or if we parse that out over time?
That is, the calculation is assuming that they draw down the entire amount.
All at once, but not
Well,
over
not
time.
necessarily all at once, just as long as it's drawn, if it were to be all drawn down by the end of June.
Okay. Okay, thank you. I may have more questions right now, I don't.
Councilman Pridemore.
Thank you, Chair. I just have some questions concerning, well, I may have another one since we were just handed this form, but it's basically regarding the first two amendments. Mr. Jameson stated that the second one may be withdrawn or possibly withdrawn because of the first one being submitted, but there's a major difference in the second one. I mean, it's basically the same as far as the amount of finance money is concerned. However, the second one requires it drops the oversight committee, which to me, I'll go into all the different oversights that the hospital already has, considering that, that you have the authority, hospital authority, and then the office of, our own Office of Finance, which I might add, if for those councilmen that have been here in the previous administration, that we had discussion in the first year, in 2016, I believe, when we were going through our budget process with the hospital, and they, at that time, because of what the council members and the administration were asking questions, they kind of, and the hospital authority, or the General Hospital staff, Dr. Webb, I think it was his first year, maybe in his second year, but they implemented a plan, and I applaud them for doing that, for changing and trying to improve and drop the deficit down. And at that time, I believe is when the Office of Finance, or the second year, I believe, is when they decided, they'll have to correct me on that, but decided to take a more, if you want to, I guess, audible stance of how, and take a little more control of their, of how the money, when the money was dispersed. And that seems to be working. I mean, they've gotten better, and they've made the plan. So I just don't think we need to duplicate that and have another an oversight committee that's going to do basically the same thing that also Metro Audit and again, Office of Finance and the Hospital Authority itself, because again, the time and effort it will take and the expertise. They may be fine now, but it may not be fine at the next, when the next group of council members you have. So then we're going through another bureaucratic process before they can get the funding that they deserve, when we have the experts that are here and have been doing it for several years. So I'm not so sure, I'm not so concerned about which amendment is best right now at this point, other than the oversight committee. I just don't agree with the having an oversight committee, and therefore I want to make sure that the amendment number 2 that my colleague Councilman Mendez has submitted to me seems like a more beneficial avenue to take. Thank you.
Thank you, Councilman. Councilman Mendez, discussion on the amendment.
So we're talking about the amendment that starts on page 20 that has 19.7 million and adds oversight committee. I guess my comment about the 19.7 is are two things. And first, for perspective, I think I went to a bunch of hospital authority meetings and urged them prior to the current fiscal year to build a budget from the ground up rather than trying to guess how much money would be appropriated as they've done in previous years. And so, I've said this before from the floor, I feel a little bit of guilt that they did that exercise, said 55 million, and then we didn't really come close to that. So I come from the perspective of having urged them to come up with the truthful, real number it takes to run the place, and having argued for more funding. On the 20 million, though, two things. One is, I can't get around that about 10 days ago, there was a press conference with Dr. Webb and Dr. Brandis, and the statement was that the 13 million was manageable. And frankly, I've acted on that over the last 10 days since that press conference, and I mean, I watched it. They said it was manageable, and I guess I'm hearing today it is, quote, manageable, but not optimal. I think I want to take them at the word from the press conference that it's manageable. Secondly, going to the full 20 million request, I think we've said would drive the undesignated funds balance down to 2.9%, which is a great deal less than what the administration proposed at 3.8. And I'd rather do this in 2 steps if necessary. And if it turns out that 13 million isn't manageable, we can come back here in a couple months and deal with it. But I suspect it probably is manageable, as they indicated, as a press conference. So for the amendment, I'm opposed to the amendment because I think the dollar amount's too high. And I think either the first or the second amendments would be a better approach. Thanks.
Thanks, Councilman Mendez. Councilman Cooper.
Thank you, Chairman. If you don't mind, I'm going to stand up here every couple of hours. It helps. I'm grateful to the Finance Department for this sheet. It's the kind of analytics that I think really shows a very professional department. This leads to two questions. If you look at the Hospital Authority request, which I guess ends up being the $19.7 million, and then the Metro Finance, which ends up being $13+ million. The question in this is, do we owe Meharry $8.3 million or $4.3 million? The biggest financial difference between the two numbers is Meharry, and I would, again, we have them here. We can ask that question. If both the hospital and Meharry would answer that question, and do we owe you over $8 million, or do we owe you only $4 million? And if we owe you over $8 million, when should we be paying it?
Councilman Cooper, Madam Chair, is it okay to comment on what Mr. Mendez said about the press conference? Because I want to clarify that.
You can go ahead and clarify.
Okay. Go back and play it. I wrote out most of what I said. I did not say that the $13.2 million was what we need. What I said was, we are grateful for the $13.2 million, and that we are looking forward to working with the mayor's office, because she is who proposed through her finance department that amount. I was very clear.
Thank you so much. Can you answer the question of Councilman Cooper's that's on the floor?
Sure, I will. And Meharry's behind me so they can back it up. But the $4.4 million that's listed in the current resolution that was forwarded is the money that we agree was owed to Meharry as of June 30th of 17. Okay? Secondarily, our PSA agreement that we have with Meharry costs or runs about $300,000 to $325,000 per month. So the other $4 million is what is projected out by the end of June 30th fiscal year. So the $8 million is the old 4.4 plus roughly $4 million for the 2018 fiscal year. So by the end of 2018 fiscal year, we believe the Meharry receivable, if nothing else is paid before then, will be north of $8 million. So that's the two numbers, and I'll defer to Meharry.
Madam Chair, that number is, I'm James Hildreth, I'm President and CEO of Meharry Medical College, and that number is correct. The other thing I'd like to point out is that, as Dr. Brandes pointed out, that when the patients stopped coming, that did damage to our ability to collect revenues as well. So we've had some challenges there, and we expect the number to be close to $11 million when all is said and done.
Thank you, Dr. Hill. Councilman Cooper, did you have any?
No, just thank you. I'm grateful to you both. Obviously, Meharry is one of the great treasures that this city or any other city could have. But if we are going to owe them $8 million, I think it's kind of false reasoning to think that we don't owe them that, and that the higher number in the Schulman bill with an extra layer of oversight protections would seem to be warranted, because we're going to be paying that in effect, we're going to be owing it for this fiscal year. So Meharry should have the confidence that we're going to be paying our debts. Thank you.
Thank you, Councilman Cooper. Councilman Glover.
Thank you, Chair. So I think everybody knows that sits on the floor, I do numbers throughout the day. And so when I saw this and I started looking at it, one of the first things I did was I actually called and made an appointment and went over to the hospital and I have to agree, I think $13.2 million last November may have worked. But I've looked at the cash flow, I've looked at the revenue adjusted, and I've looked at the cash flow analysis going forward. And unfortunately, I think everybody is telling the truth back here, that unfortunately, we've been kind of our own worst nightmare with this. So I want to go back to the finance department, if I may. We had, if I remember correctly, and I'm going to have to depend on the director of finance to give me the exact number. I want to say we had like $74 million we took out of our reserve funds for operational purposes for our current operating budget in our 18-19 operational budget. Am I remembering that number correctly?
That amount is an amount that's budgeted. When we budget that isn't necessarily always used.
Okay, well, and that kind of gets to the point of where I'm trying to go. So we talk about we're going to draw down to 2.92 or 3.85 or blah, 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 whatever. In reality, are we going to? Because we're close enough now that if we look at the anticipated and projected revenues off of property tax collections, if we look at sales tax collections, if in fact we're running above, if we're running right at, and I don't look at sales tax revenues on a monthly basis anymore, I'm trying to find out if we follow and if we take Councilman Schulman's bill for the 19.7, or maybe I heard it was 18 if the 1.7 is brought back out, if we drop it down to 18, then will we truly, on June 30th, draw ourselves down to 2.9 or 2.85 or whatever the case may be? And then, if I can, this is a procedural question I have. I keep hearing the word amendment. Everything I see here is substitutes.
Substitute.
Okay, I just want to make sure we're not talking about amending the original bill. We're talking about substitute bills. Okay, so with that, I look forward to hearing the answers.
Okay, in terms of fund balance, you're correct. Those are estimates based on where we think we will be at June 30. As we mentioned, when we considered the 4% resolution, the majority of our property taxes, we simply don't have those revenues in yet. Okay, so we are basing any estimates that we may have based on historical information. But today, I can't tell you that that there's going to be some significant growth or some huge surprise over our budget estimate. Okay. As originally planned, and the same with sales tax.
Okay. And I want to go back to the lease agreement, if I may. I think the original lease agreement is between the city and Meharry, and then there's a lease agreement for the hospital authority.
Yeah, the lease agreement, if I'm not mistaken, I'm looking at legal, is between the hospital authority and Meharry. The city is not a party to that.
The city did not take, is no part of the lease with regards to the general hospital?
I'll make sure that legal can back me up on this.
The lease agreement is between Meharry and the hospital authority. Metro has an agreement with the hospital authority where we pay, part of the subsidy is the rent payments that go to Meharry, which is used to pay the debt service on the bonds from when they rehabbed Hubbard Hospital.
Okay, so I think we need to take into account what Councilman Cooper asked, and thank you, Councilman, for clarifying the amount of money that we, the city, owe, no matter where the agreement happens to lie. If we say we're stopping this today, we still owe that money, and we have an obligation to pay that money. So if, in fact, we have that, I'll renew right now my support and to give them at least the $18 million, if at all possible. If we need to break it into two payments, I guess I would ask the hospital authority to say, if we gave you 10 today, if we gave you 10 in a month and a half, can you make sure payroll's there? Can you do all those things? And it's a question they would have to answer. I don't want to put the city in jeopardy financially. In the same breath, if we create some of our own nightmare, I think we have a responsibility to own up to the mistakes we perhaps made prematurely. Thank you, Chair.
Thank you, Councilman. Council Lady Dow, discussion on the press your button again, Council Lady. Council Lady Dow.
Thank you. Several of my questions have already been answered, but I will make a comment on these proposed substitutes. From a budgeting perspective, I'm uncomfortable drawing down our fund balance as low as it would be to 2.9, which one of Schulman's bills, and the 2.92. And I do agree with Councilman Glover that when people tell you they need a certain amount to operate, that's what they need. Otherwise, obviously, services will be cut. So I don't know. This is just so much. I think the proposal that the Finance Department has put forth with regard to where the $2.4 million comes from, I think that's sufficient. I wish we'd go back and reconsider that, because those are dollars that have been set aside that are not being utilized. And those are dollars that I think from that perspective we should utilize first before tapping into our reserve balance. So I don't see any type of proposal or substitute up here that basically looks at taking the $2.4 million from what was originally submitted. And I wish that we would reconsider that, to take the $2.4 million from there, because what that would do is not put our fund balances so low. And then the other thing is, I do understand the dollar amount for Meharry, and also that the hospital is requesting. But if we know at the end of June that we get our revenues, more revenues in, is there an opportunity to, instead of drawing down our fund balance, to take the revenue we get then and allocate additional funds at that time? You know, my concern is drawing down our fund balance. You know, and I just want to be clear about that. I'm very uncomfortable with that. And all the substitutes I see is looking at drawing down our fund balance to a percentage that really I'm quite uncomfortable with. Because if we do have things that come up in the city, emergencies and so forth, we don't know what we're coming into. We'll have to prioritize, and we won't have the funds readily available to handle those things. The other thing is, I don't mind an oversight committee, because I think in the last, I guess, 6-7 years that I've served on council, we've played this same game about the hospital, and we've had numerous conversations. And I think, you know, fundamentally, I ask people this all the time. I said we have to decide whether we want to be in the public health business or not. And if we want to be in the public health business, if they say this is how much it costs, then we just have to prioritize it and say this is what we're going to pay, this is what it costs, and this is what we're going to do. And really, when we start there and get on the same page about that decision, everything else is easy, because you budget and allocate from there. I will say that you know, I want to make a comment about the ICE Center and other things in the city. I don't think we should get into comparing a priority over entertainment, or putting in an ICE Center that generates funds that enable us to support the hospital, and talk about that as a competing priority, because I think they're both important. You know, the ICE Center, I know I have one out of my district. It generates a lot of money, and the revenues that we have, it pays for what is put there, and also gives us a little money to put back to cover things like this. So, and it's health care, because people are getting exercise. So I just think it's not about competing with other things in the city. It's about just determining what our priority is, and getting comfortable with the fact that we're providing care for indigent people, that we're not going to get 100% reimbursement from. We could get some revenues from it, but determining at what level we want to fund the hospital, whether we want to have public health care, and then allocating the money and giving it to them. And I hope that, you know, if we can get past this year, we can come to some kind of term. And I do believe an oversight committee will help us get there, because it will put some people on the council at the table with the right amount of knowledge and skills, the finance people, the college, and we can come up with, you know, how do we see health care in this city going forward? And so those are my comments. I could support something that put the $2.4 million back in where it comes from, these designated accounts, and also with the oversight committee.
Thank you, Council Lady. Councilman Pulley.
Thank you, Madam Chair. Got several questions for several different parties. I'll start with the administration. I don't think I've heard from anyone in the administration as to how you arrived at your number. I wonder if you'd like to comment on that.
Director Lomax O'Neill.
I would. Thank you. Thank you very much. As you all know, when we received the request from the authority for the $19.7 million, we submitted a series of questions to the authority, and I think 24 questions, whatever, and they were very responsive to us and answered all of our questions, and we fully vetted those. So I'll walk through with you how we got from the 19.7 to the 13.2 that is before you today. The only adjustments that have been made to that number is we reduced it for the stay pay and the associated fringe. And that was with an assumption that if we were to implement a hiring freeze on the Metro side, then I could not recommend to the mayor that we do those bonuses and those stay pay amounts right now. And as Bruce mentioned earlier, we did have a discussion about that, and I think he agreed from a cash flow perspective that the authority may still decide to do that, but it didn't necessarily have to happen this fiscal year. So that's a little over $2 million of the reduction that we took. There was also an amount in there for contract labor that I think we got Mr. Nairmore comfortable with, and we adjusted that number by about downward by about $400,000, and the balance of the adjustment was essentially, we were told that out of the 19.7, 8.3 of that was intended for Meharry. We knew that at least a little over $4 million of that was a number that everyone could agree to in terms of the June 30, 2017 number. That was an audited number. Both parties agreed that that was a valid number. What was not agreed to, and I think you just heard that a moment ago, is in terms of what that estimate of costs would be for the current fiscal year. So it's somewhere between 8 and 11 million for the current year. So if you look closely at the resolution as it was filed, we have put in a clause that we would bring in some auditors, just as we did for last year, and have the auditors go in there and bring us back a number that is reconciled so that so we can do away with this notion of having a dispute between what that number should be. So that is recognized in the actual legislation that was filed. I think that there was a discussion around whether or not we made any adjustments for revenue. This recommendation did not reduce the recommendation at all around any of the revenue assumptions that were provided to us by the authority in their analysis. So essentially, everything else is the same in terms of the administration's recommendation before you and how we got to the 13.2 million. Is that thorough enough, or did you need me to go into any?
That was pretty thorough, yes.
Okay.
I appreciate that very much. Would you like to comment on the impact of these proposed amendments?
Substitutes.
From the various
Excuse me, I keep using the wrong
substitutes?
language. Substitutes, excuse me.
I would like to comment on my recommendation.
All right, go ahead.
And my recommendation was to, first of all, go in and look at accounts where we would actually have natural savings in the department's budgets, because I did not want to go to the departments and ask them to help us tighten our belts before we looked at accounts where public safety and services to the community would be impacted. So I felt strongly that we ought to look at those accounts first, and those are the ones that are recommended in here for consideration for impoundment.
Okay, and if we move forward with these amendments, right now, your proposal, I believe, drops the fund balance to 3.85, and any of those other amendments would be 3.6, 2.9, 2.92. Yet I hear Mr. Jamerson say that the hiring freeze is off on all of those. Well, how are we going to make up that difference?
Well, I don't know that the hiring freeze is, I don't know what you mean by off.
Well, I did hear the language of the hiring freeze coming off of those amendments is what I believe I heard.
Okay.
Is that right, Mr. Jameson?
In the recitals, there's a reference to the hiring freeze, and the majority of amendments and substitutes delete that, but not all of them.
Okay, well, I would like to say that if that were taken out, as finance director, I still have a responsibility to manage the city's finances, and I would have to make some decisions about what actions might be available to me to generate some savings. So I'm not saying that if that recital were to leave, that hiring freeze would go away.
So that still is on the table as an option for how to fund this?
From my perspective, yes.
Okay. All right. I have just a couple of brief questions for the hospital in Meharry. You mentioned, Mr. Nairmore?
Yes.
You mentioned a 30% drop, and I didn't catch whether that was patients or revenue.
That's revenues.
Revenue.
It's actual cash collection type revenue, not just gross revenue, but what we actually collect.
And do you expect this to be maybe possibly worse than even the 19.7 million?
Yeah, I wanted to clarify, when we put this together for the finance department, the mayor administration, I had assumed a 15% decline in those patient revenues. It's been worse than I expected. I hope it, with the reset, and some of the conversation with council, that will start to trickle back and those numbers will return to what they were prior to the announcement. But right now, it is the best guess we had at the time. Unfortunately, I was too conservative. So the number looks worse. I think the finance director's charge has been that whatever the impact is in that net revenue, I would have to basically, the hospital authority would have to show that there's $4 million of underperformance in net revenue in order to access $4 million of the 13.2. And that, right now, it looks like we're going to hit that number and then some, unless things start to return. So, we see a harder hit on the net revenue line thus far than we had anticipated. We put that together at the end, just after Thanksgiving initially, and it was still fairly early in the process.
So the reality is 19.7 may not even get it all, and you're going to be coming back to us for more, right?
It's possible. I did just say the other point was, I don't know if finance director, if it was clear or not, but it will be that we will owe Meharry at least $8.3 million by the end of this fiscal year if we don't pay them. So I don't know if that's how we got from 17 to 13, but that's just that becomes a timing issue, and so we're just pushing a payable out into the next fiscal year that we would ask you guys to help us cover in the next budget cycle. Because there's budgeting and then there's cash flow, and the hospital authority basically works on a cash flow, and that's why we have calls with finance, each week to go over where we are from a cash. They've always been very flexible to say up to the 35, that we could ask for it early if we need it. And I'm a finance guy, as is my staff. We don't ask for it when we don't need it. We wait and we defer. That's the way we operate. So if it was 19 advanced, if we didn't need it, we won't ask for it. They see it in my cash flow statement every week.
Okay. Now let's talk about the Meharry, what you owe Meharry. Now, I guess to use the term owe, we don't currently owe them over $8 million. Isn't some of that for rent and services yet to be performed?
No, what we owe them today is probably about $6.3 million.
Okay. The rest is what will accrue beyond
today. About $325,000 additional each month.
Okay, and that could go up because I believe I heard Dr. Hildreth say that could be $11 million instead of the over $8 million. Is that correct, Dr. Hildreth?
The point needs to be made that whereas the hospital has suffered revenue declines because of patients not coming, so has Meharry Medical College. Because the hospital has two customers, the patients they take care of and the doctors who provide the services to those patients, and both have suffered. So we're in exactly the same position as the hospital, and it's our best interest to try to fix this together. That's what we're trying to do.
Okay. Thank you. A fine District 25 constituent, Dr. Hildreth. I don't have anything further. Thank you, Madam Chair.
Thank you, Councilman. Council Lady Gilmore.
Thank you, Chair Vercher. I wanted to ask Dr. Hildreth if he could just speak a little bit more to the impact of the $19.7 million, or do you feel like you just addressed that? The impact of not having it, if you could just speak briefly, and then I'll have a quick comment.
One of the consequences of not fully funding operations in the hospital would be that services will have to be closed. OB operating rooms will be curtailed, hours will be curtailed. And for us, that has two implications. One is revenue. The other is training opportunities for our students and residents. I need to make the point that we still send our students and residents to Nashville General. That has not changed. The HCA opportunity is an addition to our training opportunities, is not a substitute for them. We are anchored in North Nashville. We always will be, and that's not going to change. So the implications of not fully funding the request is services being curtailed and implications for training and for revenue for us. So yes, there would be an impact. And thank you for the opportunity.
Thank you.
My name is Veronica Mallett, and I'm Dean of the School of Medicine. And I just wanted to clarify for the council that the residents at Nashville General have no other place to train. And so the mayor's announcement sent shudders through our community. And for many of our physicians who are hospital-based, it also was a terrible announcement because that's where they work. And if they provide care only in the hospital, for example, in the ICU, that announcement meant, I don't have a job. Everybody always wants to know what's going to happen to me. And so the 19.7 is important to provide that stability and that security so that we can retain the faculty to provide the education to our students, care for our patients, the outcomes that you expect for our community, and the training for our residents. Thank you.
Thank you. Okay. So I have a quick comment. I thank Dr. Mallett and Dr. Hildreth both for speaking. I also wanted to just quickly thank Councilmember Mendez and Councilmember Weiner for readjusting where the money came from. I thought it was a little bit draconian, and most people felt that it pitted. I mean, because everybody appreciates fire, right? Some people might have issues with the police department, but everybody appreciates fire. And so to say that we would cut or do a hiring freeze, I wanted to know what was the plan if the fires increase, because if we do a freeze, we have to have something in place, and if there was something in place for this freeze from the mayor's office. Because if you're freezing fire, and we're having fires all over the city, and it's more pressures, what was in place to do that if we're going to do a hiring freeze?
In terms of the hiring freeze, we sent out a communication to the Metro Council last week, and first responders will not be impacted by this hiring freeze. So, which includes firefighters, of course.
Okay, so who are we?
It would be, we would review those on a we would review position requests and promotions on a case-by-case basis is what we told the departments. Okay. So that each of those would be reviewed independently based upon the merits of the position to be filled.
Okay, thank you. And so the second piece I was going to share as well, I like Councilmember Schumann's bill because we at the council, I'm trying to figure it out. I don't know really what's going on because the hospital has been asking for the 53 million since. So nothing's really changed. At the end of the day, we're still getting there. And I think if we're saying that we're going to support the hospital, we need to support the hospital. There have been some egregious things that have happened within the last couple of months, the lack of transparency, reckless announcements, and it seems like if nothing else, we would fix that part, right? We need to fix that. We know that it had a direct impact on the hospital. It had a direct impact on its patients. We say, well, I don't know, the hospital authority, they never really tell us what they want. They come and they tell us what they want. And when they tell us what they want, we don't fund it, right? And so then they tweak it a little bit and we say, well, they're not really telling the truth. I think it's at this point, we have to decide. We know what the truth is, right? So at this point, we need to decide, are we going to fund the hospital fully? Because it has been underfunded. There's no mismanagement. There's nothing wrong with management. We just have to decide as council members. We know the truth if nobody else does. And I think it's time for us just to be honest about it. We know that has been underfunded for years. Mendez took the bill forward December. They asked for $53 million. The council did not support it. They did not, right? So we're back here again, and we're acting like it's the hospital authority's fault, Mayor General, and the hospital, when we know, in fact, it's not. And then there was another announcement made. So I feel like if we give latitude to other parties, there was a report done. We've never seen the report. Where's that report, right? So if we give latitude to the other parties involved, we need to extend that same grace and latitude to the hospital. They have been saying over and over that they need the $53 million. We have done everything to cut and chop. We pick them up with one hand and then we poke them in the eye with the other. So they have told us in detail why they need the $53 million. People say, well, Dr. Hildreth's not here with Dr. Webb. Well, both of them are here today. They're asking for the money. I mean, so come on. What else do you want? They say, we don't get a detailed budget. You've gotten a detailed budget. This time it's time to move forward. We know that there was a reckless announcement made. We owe them that respect. We owe them that grace. They've been asking this over and over again, right? We talk about the fund. The fund will be replenished in June. We make all kinds of adjustments for all kinds of businesses, all kinds of other things. I think we need to get our priorities straight. Crime is a problem in the city. Healthcare is a problem in the city. We need to decide. And all these people that say there are liberals on council, let's see where your votes are. I'm tired of playing games. Let's see, put your vote. They said, so where's a man's treasure is his heart. Let's see where you are. You go flip-flop, flip-flop, flip-flop. They've told you, everybody's here. Let's vote on it, up or down. I support Schuman's bill. I encourage everybody else to do the rest. Thank you.
Thank you, Council Lady. Council Lady Weiner.
I may have a compromise. Maybe. So what I'm going to propose, I would like to hear from Finance, from Hospital Authority, and from Mr. Schulman and the other sponsors, and then I want to hear from everybody. Let me propose it first. So we start with 19.7 million. If we subtract the stay pay, the fringe, and the contract labor, we get to 17,141. If we keep using the designated account revenues that are unclaimed right now to 2.4 million, that takes it down to 14,741. Remember that Finance has already said they're going to look for additional revenues elsewhere that would help us keep from taking 14,741 from the undesignated fund balance. So we're close. They've already identified that they don't need some of these things immediately and that it can roll into 2019. So that's my revenue piece. Now, I'd like to speak to the Collaborative Strategic Planning Committee. To say it's an oversight committee is probably a misnomer. It is about time, and if nobody gets it by now, we have one table here, we have one group here, we have another group over here, but at no point in time has everybody come together to develop a long-term strategic plan that makes sense for our underserved. And that's our responsibility. Whether it's going to stay the same, whether we're going to scale it back, this community, the underserved, our taxpayers deserve the opportunity for us to get our collective act together and do it right and be committed to getting it right. So I would be happy to amend, if my co-sponsors are good with it, I would be happy to amend the one that starts on your page 15, include it exactly what I have shared, and let's move on, please. Do the right thing. Thank you. So that means we probably need to hear from some folks.
Council Lady, we have Schulman's motion on the floor. Are you moving to amend his substitute?
No, I would vote his substitute down and switch to the other one unless he'll accept the amendment. it'd probably be easier if he'd accept the amendment. You want me to bullet point this one?
I want us to, so that it's clean and so that,
Yeah.
yeah. Vice Chair Schulman.
Thank you, Madam Chair. So as I understand it, I understand what the proposal is. But I did hear the sponsor of this proposed amendment say that she'd like to hear from the different parties, if that's possible, before I actually would determine whether I want to take it on as a friendly amendment.
That's fine.
Councilman Glover.
Okay, Chair, I need to ask a couple of questions. If I could, first of all, I'd like Meharry, if you could, I need to understand a couple of things from Meharry, if I could ask you guys a couple of questions with the permission from the Chair. And hopefully this will accommodate some of the questions in the room right now. The $4.3 million that you did not receive by June 30th of 2017, what has that caused? What problem has that caused for you, your staff, your college, for your training opportunities? What exactly, what have you had to do in order to adjust it, because you've not gotten that money? And I know in running a business, if I did not get the revenues I had projected, I got to make changes.
We have experienced some not insignificant cash flow issues because of it. We've been able to manage it, but we cannot defer getting those funds until the next fiscal year, if that's what you're asking. That would not work well for us.
So right now, what you're saying is it's manageable if you can get the 4.3 in a relatively short term.
Yes, sir.
And then we negotiate the balance, the $333,000 and $360,000, whatever the number is per month as we go forward. So the 4.3 is the most pressing issue for Meharry.
Correct.
Okay, thank you, sir. All right. So now let's go back to the hospital, if I may, and ask, I'm not sure who, on accounts payable. If we get...
He's going to go get Bruce.
Okay, yeah, I think so. So here's the question to the hospital. Meharry has answered their question on the $4.3 million. I think I have a firm understanding of where that is. On accounts payable, if we accommodate the proposed amendment, does it allow you to pay what needs to be paid right now, and will it impact the services with regards to the credit worthiness for the hospital, to where you can continue operating and doing that which needs to be done on a daily basis to take care of the population you serve?
I'll just say Meharry is our biggest financial responsibility on a go-forward basis. It's obviously been having an effect on them that we haven't had enough money to pay going forward. You're a finance guy. I mean, we can move things out and pay them after the fact, but we've had challenges since the announcement with major creditors, not because we don't have the money, because they're fearful that our credit worthiness after June 30th is problematic. So can we, the capital issue that we talked about here, we rent a lot of equipment in the hospital because there's not capital. So hospital beds, pumps for patients that we use to infuse meds on the floor, we rent all that at a very high carrying load because we can't get capital for it. So there are all sorts of things we can do to make this operationally better. Your direct question is, I try to keep our accounts payable, excluding Meharry, in about $2.5 to $3 million range, which is 60 to 90 days.
Okay.
It's not ideal, but that's...
So we've moved from the 180 and the 120 down to the 60 to 90.
60 to 90,
See, I
excluding
applaud you for that.
Meharry,
That's good.
excluding Meharry.
Okay, thank you.
Okay.
Now to the administration. Here's the question I would ask of the administration. Can we stop being kids? Can we start actually stand up and have a real conversation, and let's try to figure out how do we solve this issue to where we collectively work as a team. I don't know if it's the 17.1 that's being proposed, the 13.2, or whatever it happens to be, but we've got to stop this. I mean, this isn't a question of being a liberal or conservative. I think we all know where I fall. We have obligations, and we entered this process understanding that they would probably come back asking for additional dollars. So what I don't want to do as we go forward is to have an announcement come out again, we're going to do this, we're going to do that. I mean, that's the one reason I filed the bill that says we won't close the hospital with the inpatient services prior to June 30th, 2019. So if we can all get together on the plate, and Councilman Schulman, I'll say, I'm going to wait. Councilman Schulman. So what I'm going to say to this is, if we can all collectively come together as a team, what a refreshing idea that would be. So thank you, Chair.
Thank you, Councilman.
Chair, could I clarify something, please?
Go ahead, Council. That's what I left you on.
Okay, good, thank you. Ms. Lomax O'Neill wanted me to clarify, and it was my misstep, I shouldn't have said it this way. When we take the sources from the primary expenditure account, that's actually classified as a budget cut. Although the revenues aren't being used, it's not revenue, it is a budget cut. So I just wanted to clarify that that's what that 2.4 million comes from. Is that better? Thank you. So, Mr. Schulman, which way are we going to go? Are we going to amend the first one, or are we going to amend yours?
Come on, Vice Chair, so we don't lose our quorum.
Move it.
All right. So thank you, Madam Chair. That may be a question for Mr. Jameson. I am comfortable with the proposed amendment. I accept that as a friendly amendment. I can put it on mine, or if it's easier to put on the other bill, the other substitute, that is fine. What is easier, Mr. Jameson? If it's easier to put it on my existing substitute, then I would invite Councilman Mendes, Council Lady Weiner, Councilman Rosenberg to join me. I know that Council Lady Gilmore, I think, is also signing on to that amendment.
As long as we get it done, it doesn't matter to me.
So I would accept that as a friendly amendment.
Councilman Mendez.
So, Mr. Jameson, we'll have to suspend the rules tomorrow night for that?
We'll have to suspend the rules. The suggestion for it to be from Councilman Schulman is that there are amendments and substitutes. If it changed the caption because it changed the total appropriation, you have to call it a substitute. Councilman Schulman's is a substitute, and if we're reducing that or changing that to 19.7 down to 17,141, that still changes the caption. So it'd be better to keep that as the substitute rather than the amendment and then make the additional changes. But I would appreciate the sponsors of the amendment to the Schulman substitute reciting exactly what they'd like to see so it can be written tomorrow.
So that it's clean, Council Lady.
Yeah, it's fine with me. For me, it's about the substance and making this work to the best of our ability and moving forward with a strategic plan.
Vice Chair Schulman.
Thank you, Madam Chair. Now, going back to Mr. Jameson, does the Council Lady need to repeat, or are you good at this point? You want her to go back over exactly what she's proposing?
You want me to give you the bullet
points? And so that the committee knows which one we are actually still on.
So you're maintaining the total allocation of 19.7 originally, but you subtract the funds for stay pay, the fringe, and the contract labor, and that gets you to 17,141. I'm trusting your math on that.
I did it twice.
You would keep the 2.4 impoundment, and then that gets you at 14.741. Then you would keep the committee, whatever we're going to call it, the oversight committee provision that was in your original amendment, correct?
Yes, hold that thought. We may have one more thing. And still delete the hiring freeze whereas.
All right.
Vice Chair Schulman.
Hey, Madam Chair, how are you? The one thing that I wanted to say, and I'm not sure if Council Lady Weiner got it, but that stay pay, this amount, the fringe benefits and the increase in contract labor, it's my understanding that it would come in the next fiscal year cycle. So it's going to be an issue then. We'll have to address it at some point, but that's why we can deal with it right now.
If needed. That was just our, the board, Hospital Authority Board actually makes that decision, but our recommendation was that we exclude that from this.
All right, so what I'm hearing is that that's going to be an issue. We need to be focused on it. It's going to be an issue come the next budget cycle, so we'll have to deal with it then.
Yeah, we're basically just moving it forward.
That's right.
Say so moved.
Oh, so moved.
Second.
Did you get what we?
Got it.
Councilman Glover.
Thank you. So, Mr. Jameson, so I just want to make sure I understand as we get ready to take this vote. Councilman Schulman, we pass his, and then tomorrow night, we'll ask for a suspension of the rules. We will have an amendment that you've taken, that Council Lady Weiner and others have said this is the appropriate way we feel like we should go forward with it. And so tonight, we would be passing Councilman Schulman's in its entirety. Tomorrow night, we would be taking on the amendment. Am I understanding that correctly?
For purposes of tonight's committee meeting, you have Councilman Schulman's substitute on the floor. He has agreed to a friendly amendment offered by Council Lady Weiner, and the details of which we recited. That is what is on the floor now.
Okay, so it is substitute as amended then?
Or amended as substituted, yes.
Okay. Okay. I just want to make sure I understand what we're voting. Okay. Thank you for the clarity.
And so that, before we take the vote, there's still some discussion. Councilman Cooper.
Thank you, Chair Lady. Real quickly, just before we get to the vote, the new number is 17.14 million, 141 million, and the intention is to keep Meharry and what we owe them current. Right, that's the big difference between the 13.7 and the 17.141 is to pay Meharry what we would be obligated to pay them due to contract. Thank you for that clarification.
Thank you, Councilman.
Right.
Going to recognize two council members that's not on the committee. Councilman Davis.
First, I have a question, just so that I understand. We're going from 19.7 to $17 million. And, I'm sorry, Councilor. Yeah. So is that because I know why we're reducing it, but isn't that money that we still owe, or how are we going to make up that somehow?
No, so the difference from the 19.7 is that we're reducing the stay pay, the fringe benefits, and the contract labor. So the difference is that's how we got to the 17, I believe, .141. I haven't done the math up here. But that's the friendly amendment to the substitute.
Okay. We all know how I feel that we need to fund the hospital and we need to pay Meharry back the money that's owed. Not trying to reiterate what Councilor Gilmore and several others have said, that we have priorities and a indigent fund hospital and making sure that Metro General and Meharry are both taken care of. And I just had a quick question for both Meharry and General. How many, Dr. Hildreth, how many employees do you employ there total at your great medical school, sir? And if someone from General will come right behind him, it'd be great.
Meharry employs over 650 individuals and, 800. 800. The 650 is our economic impact on the region, just for added interest.
Thank you, sir. And Dr. Webb, how many employees does Metro General employ?
We have about 550 employees at the hospital. And Councilman Davis, can I just add one quick, your point, how we got from 19.7 to 17.1, the biggest change is the retention pay or the stay pay. And just so everyone is clear, that's just a cash flow issue, pushing it out into the next fiscal year. So we'll be right back asking for that $2.1 million. It's just a timing issue. We can't avoid it. So I just make that clarification on that one item.
Thank you. We all talk about Nashville and wanting jobs and bringing jobs to Nashville. if you look at the thousands of people that are employed by the hospital and not counting their vendors, we have to do what's right. And I'm in support, and I'm going to be pleading and asking my other colleagues and my caucus members to please support fully funding the hospital once again. And I stand in support. Thank you, Councilman Schulman, Mendez, and Gilmore for your support. I appreciate it. But I will stand with my colleagues. And thank you, Madam Chair, for letting me speak. And just a reminder that priorities, hospitals are very important.
Thank you, Councilman Davis. Councilman Hastings.
Thank you, Madam Chair. I just wanted to, I'm not on this committee, but part of the health and hospitals area. I just wanted to first thank Ms. Talia Lomax for doing your job, which you do, but also under the guidelines for which you have to work. I know that there are special things that are in place, and we're not sure where all of that stuff comes from. There was an announcement made, and with that announcement made, hardship came into play. I do want to get on the side to where we just, your committee tonight just approved $800,000 for some trash cans. And $800,000 could do a lot with the health and of our constituents here in the city. But the hospital, we argue over fully funding this thing. This was a part of the sector of us doing our last budget time when they asked for $55 million, which I know the administration also had some constituents over there to assist in that process, but we gave them actually nothing. And again, Meharry is in a place right now to where the old merger agreement, and this is what I found out from reading the initial merger agreement, there is a 13% interest rate on if we are behind on payment or doing anything with that agreement. There is a 13% interest rate. I don't know who did that before us, but they basically put us in a bad place. There is a 13% interest rate, guys, that we have to make up. All this time that we're using and we're fussing and we're fighting and we're doing all of this stuff, there's things we have to take care of and get to the healthcare rule, making sure that our constituents are taken care of. That is basically it that I wanted to speak tonight. I am supporting Councilman Schulman's agreement as we go forward.
Thank you, Councilman. We need to move forward. I don't need to lose my quorum.
All right, don't lose your quorum. Thank you.
Council Lady Weiner.
I just want to clarify something for Mr. Hastings. 4% money can't be used for the hospital unless it's for a capital need such as equipment. And so we can't use it for operating expenses. So it's two completely different buckets of money. And I call for the question.
Can't do that.
You just a little bit out of order, Council Lady. So thank everyone for being patient. I know we're amending a lot of money here on the floor, so I just want to make sure that it's clear. I'm going to ask Attorney Jameson to make sure that everyone understands what it is that we're actually voting on as it relates to this amended substitute.
For purposes of this committee meeting, Councilman Schulman's substitute appropriated 19.7. By virtue of Council Lady Weiner's amendment to that substitute, it is reduced from 19.7 by the stay pay, fringe, and contract labor amounts, leaving a sum of 17.141. You will retain the $2.4 million impoundment, leaving 14.741 from the general fund. The committee oversight will be retained from the original agreement, original amendment submitted by Council Lady Weiner, and the reference in the recitals clause to the hiring freeze will be deleted. That is the motion on the floor. It has been seconded, I believe.
Yeah, it's been moved and properly seconded. The substitute as amended. Seeing no discussion, all in favor? Aye. Opposed? The resolution passes as amended as substituted. Councilman Glover.
All right, Chair, considering we've adopted this and spent a lot of time with this, does everybody now need to withdraw the other substitutes that are out there? I think that we've come to, no?
No.
We're staying right there with them. Oh, goody. Okay.
Is that everything?
That's it.
Okay, Budget and Finance, thank you so much, committee. We are adjourned.
Oh, we're not, okay.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.